Nick Egeroff, Florida State Sovereignty.
I represent over 4,000 members from around the state of Florida. I rise in strong support of this bill. Thank you.
All right, thank you. Sally West, Florida Retail Federation.
Waive and support, Mr. Chair.
Jessica Lowe Minor, for Florida Alliance of Planned Parenthood Affiliates.
Would like to waive in opposition.
Okay. And William Wood.
Waiver and support.
I'm sorry?
Waiver and support.
All right, thank you. All right, members, that concludes public testimony. We are now in debate. Let me get my list ready. Who would like to debate? Representative Roberson, you're recognized in debate.
Thank you, Mr. Chair. Members, what I find offensive is not having access to care. It's not having being able to afford care. And South Florida, a young woman just got seriously injured this past weekend. Her parents do not have health insurance. They're holding car wash to make sure that she gets the care that she needs. What I find offensive as a nurse is knowing that 20% of our population do not have access to care. I have to tell you what happened to me one day. My daughter was sick, and I have insurance, but I forgot to carry my card with me. And
it was brilliant,
I went out
wasn't it?
with her, and she ended up having a very high fever. I had no idea. By the time I get her to Parkway Hospital, I had to strip her of her clothes, turn on the air conditioning just to help her. When I got there, they asked me for my insurance, and I did not have my card with me. They asked me for a down payment of $300. I did not have a checkbook, but God was good. I ended up having one single check, only one single check. And if I did not have that check, I would have had to go to Jackson Hospital, which was about 45 minutes from my house. And that's my only child. That is what is offensive. When you
That you're
have
irresponsible?
800 children not being able to access to care, and you are
You
a
just didn't
parent,
have your card.
that is what is offensive. We have tried in the state of Florida. I have been for 8 years here. We have passed several reforms. We have passed Cover Florida, several flex programs. We still have 20% of our population uninsured. That is
Voluntarily.
what is offensive to me.
You're welcome. Representative Raywinkle-Vassallini, you're recognized.
I agree with Representative Roberson that that kind of care for our children and our citizens is offensive. I also care about my fellow Americans. Not only do I care about them, but I am also very concerned about our ability to not only defend ourselves, but to produce and be productive against other countries that are building up their economies. Every society has realized, it seems but ours, that the health of our fellow citizens is extremely important. The 50 states have tried for decades, we have been in a healthcare crisis, to fix it, and they have not done that. We get deeper and deeper and deeper into the hole. The federal government has passed a bill yesterday. It may still have problems, I'm sure it will. And this is a part of that bill, an important part. What this resolution would be trying to undo. And I believe that we need to make sure that we have health care in this country, that it is a federal issue, and that the states need to not stand in the way of this of the nation's attempt to take care of our health care, because it is a national issue.
Representative Randy Martin, you're recognized.
Thank you, Mr. Chair. Well, this is an important joint resolution. It defends our citizens' and employers' rights to make health care plan decisions on their own. You know, the free market will allow competition and in that way allow for improved affordability. You know, I'm proud to be a co-sponsor of this resolution, and I urge your support too. The federal government should not be in the position to force upon our citizens to purchase any specific product or any specific plan. And we need to defend our citizens' rights, and I think this is a way that we need to stand up. Thank you.
Representative Hudson, you're recognized in debate.
Thank you, Mr. Chairman. There's been a lot of discussion on this issue, and some of it doesn't seem like it's really very germane to the actual resolution that we're talking about. We've heard discussion about auto insurance. We've had some theatrics on theater. We've had some discussion on numbers. We've had debate on many different things. To me, it's very simple, really. We're Americans. We have certain personal freedoms and certain personal liberties that, quite frankly, are in this document right here. And nowhere in there do I see in the Bill of Rights that health care is in the Bill of Rights. I do not believe that we should have to, as Floridians, have individual mandates forced upon us that have failed in other areas, that have been disastrous to other states, and quite frankly, failed to adhere to the 10th Amendment of the Constitution. I believe that this vote is important for a number of reasons, the least of which is that the people in the audience today and the people that are sitting at home that might be watching us in their offices, this is your future. This is the future of your state. This is the future of your financial livelihood, the financial livelihood of our small businesses and large businesses throughout the state. It is the financial future for our entire economy. And I believe a decision that is this important should fall on the people that put us in office, and every citizen ought to have that right. And I believe that it, quite frankly, may be a violation of the First Amendment if we don't allow for freedom of speech and the exercising of our public right to vote and to make sure that this is what we want or what we don't want. And I wholeheartedly support this, and I look forward to seeing it pass. Thank you.